This is the news in brief from the United Nations. The UN World Health Organization, or WHO, said on Monday that it's working day and night to keep medical aid flowing into Ukraine following Russia's invasion more than 2 weeks ago. The relief effort has continued despite missile attacks on at least 24 healthcare facilities, workers and patients in Ukrainian cities, which have killed 12 people and injured 34. Another key priority of the WHO relief effort is to provide support to neighbouring countries' healthcare systems amid an ongoing exodus of Ukrainians fleeing the war, which is now approaching 3 million people. Supply chains have been severely disrupted, the UN Health Agency said in a statement, adding that many distributors are not operational, some stockpiles are inaccessible owing to military operations, medicine supplies are running low, and hospitals are struggling to provide care to the sick and wounded. Some 18 million people in Ukraine are believed to have been affected by the war, including 6.7 million internally displaced. Chronic and emergency needs have stretched medical facilities to breaking point, with WHO reporting that nurses have had to ventilate patients manually in hospital basements away from Russian shelling that has been condemned by the UN rights chief. Among the most needed life-saving supplies, the UN Health Agency has sourced oxygen and insulin, surgical supplies, anaesthetic and transfusion kits to collect, test and safely transfuse blood. Staying with Ukraine, electricity has been restored to the stricken Chernobyl nuclear reactor after power was lost following the site's occupation by Russian forces on the 24th of February. Announcing the news on Sunday, the UN Atomic Energy Agency, IAEA, said that the plant's backup diesel generators could now be turned off. IAEA Director General Rafael Grossi explained that there had not been any critical impact on safety, as Chernobyl's spent fuel rods have continued to be cooled by the existing water tanks. But Mr. Grossi said that he was still gravely concerned about safety and security at Chernobyl and Ukraine's other nuclear facilities. At the Zaporizhzhia nuclear power plant, which has been under Russian control since the 4th of March, the IAEA chief said that Ukrainian technicians had been joined by Russian representatives contravening safety directives. Yemen's already dire hunger crisis is teetering on the edge of outright catastrophe, the UN warned on Monday, as new data analysis indicated potentially record food insecurity there. Today, more than 17.4 million Yemenis are food insecure, and an additional 1.6 million are expected to fall into emergency levels of hunger in coming months, taking the total of those with emergency needs to 7.3 million by the end of the year. Of extreme concern to humanitarians is the likelihood that the number of people experiencing catastrophic or famine-like levels of hunger will increase fivefold to 161,000 by the 31st of December. World Food Programme Executive Director David Beasley said that we are almost out of time to avoid catastrophe, and he added that unless the agency received substantial new funding immediately, mass starvation and famine will follow. Daniel Johnson, UN News. This is the news in brief from the United Nations. Almost one child per second in Ukraine is becoming a refugee of the war, UN humanitarians said on Tuesday, as the total number of people who have now fled the country since the Russian invasion began passed 3 million. Highlighting that 9 in 10 of those fleeing unrelenting violence in Ukraine are women and children, the UN Children's Fund UNICEF warned that youngsters are prey to traffickers as they arrive in unfamiliar new surroundings. The development follows a warning from the UN Secretary-General, who on Monday said that Russia's military offensive against civilians was reaching terrifying proportions. At Ukraine's border with neighbouring countries, overwhelming numbers of traumatised people have arrived, creating opportunities for criminal gangs who are known to flourish in conflicts, as UNICEF spokesperson James Elder told journalists in Geneva.
To give a sense, at the border that I used to visit, the main border, Medyak, Poland to Ukraine, it is scores of people standing around buses and minivans calling out names of capital cities, or at least it was a week ago, and people getting onto those. The vast, vast majority, of course, are people with wonderful intentions and great generosity, but there is no doubt, given what we understand of trafficking in Europe, and that remains a very, very grave issue.
Staying with Ukraine, humanitarians warned that the situation in the port city of Mariupol has deteriorated further after more heavy Russian bombardment. Hundreds of thousands of people are being suffocated by a lack of supplies and are unable to flee the city besieged by Russian forces, said the International Committee for the Red Cross, ICRC. Spokesperson Ewan Watson also confirmed that a small number of vehicles had managed to get out of Mariupol on Monday, but this was just a drop in the ocean compared with those left behind. Amid reports that families are being forced to gather water from streams and that fights have broken out over food, Mr. Watson urged the Ukrainian and Russian authorities to find a solution so that aid can reach the city's people. To Myanmar, where security forces have killed at least 1,600 people and detained more than 12,500 since the military coup last year, the UN Rights Office said on Tuesday, in a new report warning that serious rights abuses uncovered in Myanmar may amount to war crimes and crimes against humanity. UN High Commissioner for Human Rights Michelle Bachelet appealed to the international community to take concerted, immediate measures to stem the spiral of violence there. The report's findings indicate that military and security forces bombarded populated areas with airstrikes and heavy weapons and deliberately targeted civilians. Many victims were shot in the head, burned to death, arbitrarily arrested, tortured or used as human shields, said UN Rights Office spokesperson Ravina Shamdasani.
Mass killings have taken place. In July, in Sagang region, soldiers killed 40 individuals in a series of raids. Villagers found the remains of some victims with their hands and feet still tied behind their backs.
At least 440,000 others have been displaced since the military takeover on the 1st of February 2021, the UN report said. A further 14 million are in need of urgent humanitarian assistance, but aid deliveries have been largely blocked by the military in new and pre-existing areas of need, it noted. Daniel Johnson, UN News. This is the news in brief from the United Nations. War in Ukraine risks seeing 90% of the country freefall into poverty and extreme vulnerability, nearly 3 weeks since Russia invaded its neighbour, a new UN report said on Wednesday. Apart from the heavy civilian death toll as Ukrainian cities have been pounded by Russian shelling, the UN development programme UNDP cited government estimates that at least $100 billion worth of buildings, roads, bridges, hospitals, schools and other vital infrastructure have been destroyed. 1 in 2 Ukrainian businesses have shut down completely, while the other half has been forced to operate well below capacity. UNDP warned that if the conflict drags on, and if more support to the country is not forthcoming quickly, it could wreck almost 2 decades of economic progress. To help prevent these shocks and protect hard-won development gains, we need peace now, said UNDP Administrator Achim Steiner. Early UN estimates indicate that nearly 3 in 10 people in Ukraine need life-saving assistance. Based on the current direction of the fighting, 18 million people will likely be affected, and more than 7 million may have to flee their homes. A funding crunch has put millions of people in Yemen at risk of catastrophe, UN Secretary-General Antonio Guterres said on Wednesday, in support of a $4.3 billion appeal to fund the relief effort in the war-torn country. After more than 7 years of war, tens of thousands of civilians, including at least 10,000 children, have died, Mr. Guterres said, adding that for millions of internally displaced people, life is a daily struggle for survival. Today, more than 23 million Yemenis face hunger, disease and other life-threatening risks as the country's basic services and economy are collapsing, according to the UN Humanitarian Coordination Office, OCHA. To make matters worse, a lack of funding has forced the UN and partners to scale back or close around 2/3 of life-saving projects, Mr. Guterres said. He warned that food rations have just been reduced for 8 million people and that this has had devastating consequences. In the coming weeks, nearly 4 million people in major cities may also lose access to safe drinking water, and 1 million women and girls may lose access to reproductive health services, which the UN chief described as a death sentence in a country where 1 woman dies every 2 hours from complications during pregnancy and childbirth. After a consistent decrease in the number of new COVID-19 cases globally since the end of January, last week saw a rise of 8%, the World Health Organization (WHO) warned on Wednesday. More than 11 million new cases and just over 43,000 new deaths were reported between the 7th and 13th of March, with over 455 million confirmed cases and over 6 million deaths from the coronavirus overall. Regionally, the Western Pacific saw the highest increase in new weekly cases of 29%, followed by Africa at 12%. But infections dropped by 20% or more in the Eastern Mediterranean, Southeast Asia and the Americas. The highest numbers of new cases were reported in the Republic of Korea, with more than 2.1 million infections, up 44%, followed by Vietnam and Germany. The highest death toll over the past week was reported in the United States, where more than 9,000 people died, a 13% decrease from the previous 7-day period. Russia reported more than 4,500 new deaths from coronavirus, which is a 15% decrease, while Brazil confirmed more than 3,300 COVID fatalities, also down 15%. Daniel Johnson, UN News. This is the news in brief from the United Nations. Amid a spate of journalist killings in Ukraine, the UN cultural agency UNESCO announced that it will issue helmets and bulletproof vests to prevent further deaths. The development on Thursday follows the deaths of Fox News journalists Oleksandra Kovshanova and Pierre Zakrzewski during shelling in Gorenka outside Kyiv on Monday. At least 2 other journalists have died since the start of Russia's military invasion on the 24th of February. UNESCO said that thousands of reporters are working across the country, often lacking protective equipment, particularly local reporters who have found themselves thrust into a war zone. The UN agency is supplying a first batch of 125 helmets and protective vests with press clearly marked to identify the journalists. Reporters will also be given training and advice on how to work in a conflict setting, and a 24-hour emergency hotline is in the pipeline for journalists who need to be evacuated from dangerous locations. UN Refugee Agency Chief Filippo Grandi has called for sustained international support for Afghanistan's people, where the country's humanitarian crisis is worsening. Speaking from Kabul at the end of a 4-day visit to Afghanistan, Mr. Grandi said that he'd met families who do not know what they will eat for their next meal. UN humanitarians have warned that a staggering 95% of Afghans do not eat enough, a figure that rises to almost 100% in women-only households. During his meetings, Mr. Grandi reiterated UNHCR's unwavering commitment to stay and deliver humanitarian aid to Afghanistan. He noted that decades of conflict had left 3.4 million people internally displaced, and that the healthcare system is ill-equipped to withstand the COVID crisis and a measles outbreak. Key workers in schools and hospitals remain unpaid, and the country's liquidity crisis, rising global food and energy costs are having a devastating effect, Mr. Grandi said. The UN's top rights official on Thursday urged the United Kingdom to reconsider proposed changes to its migration policy, warning that the reforms would see vulnerable people criminalised for entering the country irregularly. The draft law was introduced in the lower house of Parliament last July, but the upper house rejected its key provisions, instead recommending changes that were more in line with international standards. UN High Commissioner for Human Rights Michelle Bachelet urged the government to bring the proposed legislation into conformity with international human rights law and the 1951 Refugee Convention. She also highlighted how the proposal could punish and deter people from rescuing migrants in distress at sea, potentially resulting in more tragic loss of life in the Channel. Daniel Johnson, UN News.
This is the news in brief from the United Nations. After a missile attack near the airport in Lviv in western Ukraine early on Friday, UN humanitarians warned that the situation across the country remains dire as Russia's military invasion continues. Now in its 4th week, the war in Ukraine has seen 44 attacks on healthcare throughout the country, including on buildings and a warehouse, patients, staff and supply chains, resulting in 12 confirmed deaths, according to WHO or World Health Organization data. Despite the dangers, the UN and its partners have continued to push for humanitarian access. Underscoring the deadly danger to civilians unable to escape Russian bombardment, the UN Refugee Agency UNHCR described the situation in cities such as Mariupol and Sumy as extremely dire, with residents facing critical and potentially fatal shortages of food, water and medicine. In the country's eastern regions, needs are becoming even more urgent, said UNHCR spokesperson Matthew Saltmarsh, where more than 200,000 people are now without access to water across several localities in the Donetsk region. More than 3.2 million people have now fled Ukraine, and millions more are internally displaced. The first injection to offer long-lasting protection against HIV is being rolled out in South Africa and Brazil as an alternative to daily medication. UN agency UNITAID announced the groundbreaking development on Friday, which it is hoped will boost HIV prevention worldwide. Developed by ViiV Healthcare and approved by the US Health Authority, the injection offers 2 months of protection against HIV. Like other HIV treatments, the antiretroviral medication works by stopping the virus from replicating in the body, effectively reducing the viral load. Although existing oral medication known as oral pre-exposure prophylaxis or oral PrEP can prevent HIV in 99% of cases, uptake's been slow and targets to reduce new infections have been missed. The reasons for this include that people with HIV fear stigma, discrimination or intimate partner violence if they take the pill every day, said UNITAID spokesperson Hervé Verheussel. And finally, UNHCR, together with 102 humanitarian and development partners, is appealing for $1.2 billion to deliver much-needed aid and protection to 2.3 million South Sudanese refugees and their host communities in the Democratic Republic of the Congo, DRC, Ethiopia, Kenya, Sudan and Uganda. After nearly a decade of conflict and despite efforts towards implementing the stalled peace agreement, South Sudan continues to grapple with sporadic violence, chronic food insecurity and the devastating impact of major flooding. The COVID-19 pandemic's also strained resources, the agency said on Friday. Funding is urgently needed to help these host countries to provide food, shelter and access to essential services such as education and healthcare, added UNHCR. Governments in the 5 countries of asylum will be supported in their efforts to integrate South Sudanese refugees in national social service systems. Matt Wells, UN News.